So let's just say you've got arthritis in your joints, hip, knee, whatever, and you've been told that you need a joint replacement surgery, and you're wondering to yourself, would a shot of cortisone keep me from needing surgery? Well, I'm Dr. Brad Homan. I'm going to answer that for you in this episode. If you find this interesting, please like and subscribe to the channel. So let's dive in. First, osteoarthritis is a condition where the cartilage in the joint has basically worn out and the bones are starting to hit each other hard. It's causing inflammation, it's causing pain, sometimes it causes catching, locking, popping, things like that. And so a lot of times when those symptoms become severe enough, we do joint replacement surgery, which is curative. It is a great procedure if you need it, and it restores your activities of daily living to be pain-free again and gives people their life back, essentially. But there are non-surgical options that should be pursued first. And let me start by saying the most important thing is a low-impact exercise program to strengthen the muscles that support the joints. That is probably the most important thing you can do to make your joints feel better. First of all, it's going to help you with your current symptoms, so you might not need the joint replacement. But second of all, even if you do end up with the joint replacement surgery, that low impact strengthening exercise program is going to facilitate your recovery from that procedure. So that's the number one. And then you get into other options like losing weight if you happen to be overweight, proper diet, heat, ice, bracing, things of that nature. But then you get into injections. And so sometimes an injection will provide substantial relief. A lot of times when people feel like their knee or their hip are unstable with arthritis, it's just the sharp pain that catches them off guard and makes them feel that way. And so if you can reduce the inflammation that causes those sharp stabbing pains, then a lot of times these instability episodes will go away. Or a lot of the instability could be because the muscles aren't strong enough to support the joints because the patient's not in an exercise program, and the argument is, I can't get into a fitness program because my joints hurt too bad. So in that scenario, an injection of cortisone can actually be extremely helpful to keep you from needing your surgical procedure. And the way that it works is it's a very, very potent anti-inflammatory. So cortisone is part of a drug class of medications called corticosteroids. And what they do is they just reduce inflammation, and they do it extremely well. And usually when you do an injection of cortisone into a joint, that cortisone will sort of stick around in the joint for up to about 3 months. And so it can provide some pretty significant pain relief during that 3 months. And for many patients, they'll experience relief months after that injection. So oftentimes, if I have a patient that has, say, knee osteoarthritis or even hip osteoarthritis, and we give a cortisone injection into the joint, those patients are completely pain-free in that joint for 3, 6, 9, sometimes even 12 months. And so in that scenario, if you failed all other conservative treatment options, including medications, oral medications, over the counter, by mouth, and you're struggling to get into a fitness program, or you're thinking that you might need a joint replacement, then an injection of cortisone can provide a good trial to see whether or not you might be able to avoid that surgery. Because in many cases, if you do get sustained relief from the injection, and then you can get into the fitness program and you can lose the weight more effectively, then you might not ever need that joint replacement surgery. Now, cortisone isn't for everyone. There are contraindications to giving cortisone, especially diabetics with sugars out of control, because steroids can increase blood sugars. So patients that are sensitive to that need to be very careful. There are some other side effects of cortisone that need to be discussed with your physician. But if it's chosen as an option for you, it can provide substantial relief. So that's my answer about cortisone and whether or not it can help you prevent your joint replacement surgery. So I hope you enjoyed the content. Please like and subscribe to the channel. I'm Dr. Brad Homan. As always, my message is take care of your body, and your body will take care of you.